Feeling bloated, foggy, or fatigued. It might be more than just a bad meal. That could be leaky gut.
Want better energy, immunity, and even mental clarity? Start with your gut.
Welcome to the Dr. Frank and Steve podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is Dr. Frank and Steve podcast. I'm your host, Frank Williams, and this is Steven Snodgrass, MD, FACS. Today we're going to be covering a topic that affects the majority of the people out there in the world one way or another, which is gut health. So we'll be covering, certain areas of it, and then Steve will go over the medical parts, and then I'll cover some interesting facts and some things possibly you can do to improve it. So without further ado, I'll give you Steve on.
Here we go.
Yeah.
This is going to be, I'm going to have some science in here that may be, it just needs to be brought out so people will understand some of it. But basically, the GI tract extends from the tongue to the anus. And in medical school, we were in cadaver lab, and it was kind of a team effort to dissect the entire gut, and we called it from tongue to bone. And it was like 30 feet long. It was the wildest looking thing, because basically you took a human being, and what they wanted was to literally lay out the digestive tract and the entire gut. Mm-hmm. And so, you start dissecting from the tongue, and then you go all the way down. So it's quite the sight, but it gives you an idea of what you're dealing with as far as how important this is for health. But anyway, goes from esophagus to stomach to the small intestine. And I do want to bring up the three parts of the small intestine: duodenum, jejunum, and ileum. And the reason I want to bring it up is because the ileum is the part of the small intestine where most of the absorption of nutrients will take place. So it's important, we were taught in surgical residency to try to spare the ileum if at all possible, because you have disease states, you have gunshot wounds to the abdomen, stabs to the abdomen where that was injured, and you try to spare as much of it as you could for that reason, because if not, people will get into what's called short gut syndrome, and they are affected terribly because of malabsorption of nutrients and things like that. So they have all kinds of medical problems when that's interrupted. So it's something that we always had to keep in mind. And the GI tract has several layers, and one of them is the mucosa. And that's like a large mucous membrane. Look at it just like a piece of cheesecloth or something like that. And it's where food makes contact with our bodies, and it's eventually absorbed into the intestine. And that's home to trillions of bacteria and fungi. And it's the center of the body's immune system. And it's the body's first defense against infection. And this layer of cells is held together in tight junctions called desmosomes. So you still awake?
I'm trying. Please watch this as many times as you need to, so you can have good trivia answers for your friends.
Exactly. It's a good thing to discuss over cocktails.
It is, yes.
Yeah, it is. But anyway, the mucosa includes a lining epithelium. It has glandular tissue that contains the exocrine glands, which secrete mucus and fluid, and there's endocrine cells that release hormones. And one of the things about it is all this is coming about, and it's been around for a long time, but it's just now getting a lot of press. And we never, as a surgeon, I never really thought too much of it other than what I had to do surgically to try to preserve tissue. That was, but sometimes you can, sometimes you can't. But anyway, there's an underlying layer of loose connective tissue called the lamina propria, and that's important because it contains glands and lymphoid tissue, and products of digestion will pass into the capillaries of the lamina propria and there's also lymphoid follicles and plasma cells there. So it's the lamina propria that connects the digestive system to the lymphatic system or the immune system. So that is an important point as to like how the nutrients actually get to the body. That is the main layer. And there's also a double layer of smooth muscle, and it's just basically you're looking at propelling food forward. That's the whole point of it all. So anyway, let me just see. I hit a wrong button here, and I've got to get back to my notes. I got to get back to my cheat sheet here. But I did want to discuss leaky gut syndrome about this, but now would be a good time for you to interject.
Well, looking at my research, I love to do research. There's a huge connection between the gut and the brain, via the vagus nerve and all that, and what affects gut health, such things like mental health, anxiety, depression, gut health can technically affect all that, because of what the gut produces. And I'm not sure how was it neurotransmitters and everything, was it serotonin?
Well, I mean, it's kind of basically just the center of your universe, because whatever's out there in the environment, or environmental toxins and all kinds of different things, we're exposed to.
And I was reading where the NIH, and that's where most of this is coming from, CDC, NIH, even some from the FDA, and then Harvard studies. I'm not a fan of Harvard, but I'll give you credit for that. Is 70% of your immune system is in your gut.
Yeah.
Which is amazing to me because, gut inflammation and unhealthy guts leads to all kinds of chronic illnesses.
Yeah.
People can't, you always hear somebody going to the doctor for, because their stomach's upset, they have pain in the stomach, they have acid reflux. And a lot of times it's got to do with your dietary habits, your exercise habits. If you travel a lot, that can mess it up. If you change your routines around, like I said, stress, anxiety, depression, all those things, which we've done a fantastic podcast on, which just got released today. So take a look at it, and you'll see what stress is and some of the things you can do to actually correct that.
I think we covered stress like no one's covered
That's
stress.
right. We did extensively for about an hour.
Yeah.
You got foods that are really, good for gut health. You've got and you may be going to cover that, like fermented foods, fiber-rich vegetables, things like bone broth and all that. And obviously the worst offenders, if you're into MAHA, Make America Healthy Again, even if you're not, the worst offenders are the ultra-processed foods, the sugars, and all the artificial sweeteners. And there's actually a couple diets out right now, and I'm not endorsing, so I'm not going to say the name of them. You can do your own research as we ask you to do your own due diligence. But they're I think they're called the gut reset diet, to where you're like resetting, trying to get your gut health back into order, because, and this all comes down to a host on a TV show, which I won't name, but it's the most popular network for streaming. And this host is always talking about poop. And so, a lot of people have no clue, and I don't know if you're going to cover that or not, how often they think people should be pooping and all that. So, which is kind of an odd topic to cover, but it has a lot to do with gut health.
Especially when it hits the fan. So that's something you got to watch out for.
Yeah. Yeah. Again, Dr. Frank and Steve podcast at gmail.com. So, a lot of people say, should you poop at least once a day? And as I'm going to speak, and you can speak on this. And ideally, according to most of the medical resources that I've read, they want people to at least evacuate their bowels 3 times a week. And that's maybe normal for some people. It's not for most people with good gut health, I can tell you, but if you eat your fiber and everything.
I would think that would constitute a bit of a backup.
What's that?
If you're pooping 3 times a week.
Well, that's according to their research on the NIH, is that they found some people, it's normal for them only to go 3 times a week. Myself, I'm like, what are you people eating? And what are you not doing? Are you just sitting there with bags of chips watching streaming shows or sports and not moving and grooving?
Well, a lot of it goes back to the point of basically you're looking at the gut is like a muscular tube.
Mhm.
And so it's called peristalsis of just the movement of food from the mouth to the anus. And it's all about just propelling forward. But a sedentary lifestyle, uh, pain medication, or there's a lot of people taking pain medications. A lot of people have sedentary lifestyles. It's like anything else. If you're not up moving and all that sort of thing, those muscles are not being kind of stimulated.
Right.
And especially if you're sedentary lifestyle, all kinds of different medications can slow that down.
Yes.
And America's on a lot of those kinds of stuff.
Yeah, because all you see are commercials, which again, Bobby Kennedy, call me and Steve, we'll be happy to talk with you. We got plenty to talk over with you. But unhealthy gut syndrome, as I call it, which is overall gut health, excuse me, my allergies are acting up, but that can lead to a range of problems according to the CDC and according again to Harvard, the American Medical Association, like gas, bloating, constipation, diarrhea, heartburn, and all of those things are going to contribute to your life. It's not going to make you feel as well. You're going to be moody, can stress you out. And a lot of that we just over medicate for, because it's every commercial you see.
Yeah.
You have gas or bloating, do this. Do you have diarrhea, do this. Do you have constant heartburn? Don't go after the root cause and figure it out. Just take this medicine and deal with it.
Yeah.
And so
just covering it up.
Yeah, just putting a Band-Aid on.
They're just covering it up and not dealing with what's there. And that, that's my wife, as we know, she's got a very very large practice, and it's all about alternative medicine and just looking at things differently at root causes of different problems. And leaky gut is one of her biggest things that she talks about.
And don't take this wrong, so don't kick me across the way, but when I had my annual physical today, which turned out excellent, all my blood work, everything, but your wife's name came up. And it was because the doctor was saying she sends a lot of ladies, because I was telling her my wife and daughter's going to see someone, and she said, oh, we send a lot of ladies to a lady in town. She's the best there is, Mary Lee. I don't know if I said, that's my best friend's wife. I'm the only one, she says, can talk to him in his Riri state. And so she said, oh my God, people just love her to death. And she's so brilliant. And I said, well, I will let her husband know, because I will see him in a little while. And
I'll pass that along. Yeah. And while we're on that, by the way, I got my testosterone drawn, and I thought like, well, I'm 67. Could I potentially have low T? I at least want to kind of find out. But it was 1,064. So.
And normal is what, 5,000?
Oh no.
I know.
Yeah, you know. Of
course I know. I'm Italian, baby.
Yeah, my lowest testosterone was 800. That was years ago. And then I got it just done the other day, it's 1,064. So I'm just going like, alpha's alpha, baby.
Yeah. When you walked by and told your wife that was all she said, good for you. She walked away.
Well, basically, her first response was she's going like, man, no wonder.
Okay. Back to the subject. Let's see.
Do you want me to cover the leaky gut now?
I'm going to cover just 2 more little quiz things, and then I'll let you go to your leaky gut.
Okay.
Syndrome.
I can hardly wait.
I'm sure, and this goes along with what your wife probably tells people. Should you take probiotics every day, no matter what? Is that true or false? The answer is false. Not everybody needs probiotics every day. And so they tell you that, the type of probiotic you take is very important. So if it's something you're considering or been mentioned, make sure you get a qualified person who knows you, your medical history, that can sit down and go over which probiotics, because there are a ton of them. on the market currently.
Mm-hmm.
And is all fiber the same? And I don't know if you want to cover that or not, but that's a myth. All fiber is not the same. You have what? Soluble and insoluble fiber do different things. Soluble fiber feeds gut bacteria, and insoluble helps move those things along.
Mm-hmm.
Yeah. That was my trivia for the day, so you can go ahead.
That's quite right. My wife and I have discussed this whole thing, this topic, because really, your health, it's just amazing how much this dictates your overall health. It's amazing. And the problem, we're looking at leaky gut syndrome. And what that is increased intestinal permeability or hyper permeability. And it just means that it may be undigested food, bacteria, or any other trigger that escapes through that membrane that I discussed earlier, the mucosa, and enters the bloodstream that causes an immune response. And that over time, it can develop into chronic disease states like what you were saying. So leaky gut syndrome is a symptom of inflammation, imbalances, and just gut hyperpermeability. And the list of health problems associated with leaky gut, I mean, it's like pages long.
Oh, absolutely.
Yeah, it's just like you're just.
It's such a hot topic right now on every station, every streaming channel. There's always something on about either leaky gut or gut health, and that's all you see. But a lot of it's like a 1 or 2 minute little synopsis of what's going on and what you can do, or it's a little plug like, and please go, and we don't have this, so don't be asking, go to the Dr. Frank and Steve nutritional shop online and get your vitamins and probiotics. We recommend and guarantee they'll work, and that's usually what you're getting out of a lot of those segments.
Oh,
we don't have that, so
no.
do it.
But basically, the small intestine will allow properly digested fats, proteins, and starches to pass through so they can be used by the cells of the body, while simultaneously providing a barrier to bad things, to keep them from going into your bloodstream, like foreign substances, large undigested molecules, bacteria, virus, fungi, that sort of thing. But when an area of the intestine becomes inflamed, the aforementioned desmosomes that keep it together, it's like a tight binding, if you will, they become loose. And when they become loose, that's when larger molecules will pass through. And those substances that pass through the junctions are seen by the immune system as foreign bodies. So it stimulates the entire cascade of the immune response, and obviously not good. And when the intestinal lining is damaged and the particle size is too large, it can be like disease-causing bacteria, fungus, potentially toxic molecules, and they go directly into these weakened cell membranes. Now they're in the bloodstream, and now you got a problem. And it should be noticed, I thought this was, if this doesn't tell you what it is, nothing will. But it's termed a translocation of bacteria. And there's like a lot of different articles on it. But there was one in particular that I read about was an elderly gentleman that was diagnosed with arthritis. He had a swollen knee, but he also had documentation of an abnormal bacterial infection in his gut. And it was an unusual kind of bacteria. And what they found when they drained his knee, that bacteria that was in his gut was in his synovial fluid or in the knee. So it just shows you, whatever was in his gut passed through all those membranes that we talked about, the loose cellular connections, got into his bloodstream and deposited into his joint. So he's diagnosed with arthritis, but why?
And now you know why.
Now you know why. But it just proves to you that the gut is central to everything, and that's just one example.
So remember that when you're having a greasy Taco Tuesday.
Yeah, it's pretty bad. And leaky gut syndrome, is associated with obviously allergies, autoimmune diseases, such as, and I'm going to go over these diseases individually because they're not usually thought of as surgical illnesses. I mean, you know, there's a lot of times that people are just treated medically, and you know, surgery is usually not even part of that care. And anyway, I'll never forget this. When I was a surgical resident, that's when AIDS came out. And I was talking to one of my fellow residents who was a year or two under me, and he just said, well, he goes, one thing about it, he goes, just thank God it's not a surgical disease. And I said, oh, I said, you haven't even seen what's going to happen here. And so HIV became, you know, we were doing chest tubes all the time for pneumonia. We were doing splenectomies for all kinds of different problems they had. So, you know, I can't, and at the time, you know, I'm a little bit off track here, but it makes a point about just care in general. But we didn't know at the time, if you'll recall, people thought like, man, if you touch somebody who has AIDS, if you touch their coat, you're probably going to die.
Yeah, when I was a cop, you know, and both in the military, when that first came out, it's like, if you're around someone, mask up, glove up. If you have to handle them, do anything, don't let them breathe on you, like tuberculosis or something. Yeah. Don't let them do, it was, the hysteria went completely off the charts.
Yeah, and then what happens is they get a certain kind of pneumonia that causes, you know, a lot of what's called empyema. And it's just like a pus-filled pleural space around the lung. And so you have to put a chest tube in to decompress that so the lung can get inflated, because it would keep the lung from getting inflated and they'd get into all kinds of different trouble. So we had to do chest tubes in now. And we would puncture a hole in the pleura, spread it, put the chest tube in, but it would be this mist of blood and pus that would just cover us. And I just thought, like, you know, how can we survive this? Because all we have is, you know, mask, and I wore glasses, but just like, if back then, you know, like if any of that would have gotten in my eye, or if I would have gotten a needle stick, I would have been dead. I mean, so my whole point is, they thought that there's probably not going to be anything surgical that's going to be involved in HIV, but there was all kinds of problems that we had to deal with. But back to my point, the leaky gut's also associated with inflammatory bowel disease, Crohn's disease, and ulcerative colitis. I'll go into that. Rheumatoid arthritis, skin irritations, asthma, eczema, bronchitis, and malabsorption syndromes. And causes of the leaky gut syndrome, one of the main ones is what you alluded to, is chronic stress. And so that is something that we addressed in the last podcast. And the other is dysbiosis. And dysbiosis is just basically an alteration of the gut microbiome, which is, microbiome is just the bacteria that's making up the gut. So a lot of times more unhealthy bacteria than healthy bacteria. And when the gut microbiome is thrown out of kilter, if you will, then you've got some major problems. But dysbiosis, you know, can come about because of a lack of beneficial bacteria and overgrowth of harmful organisms, or a loss of microbial diversity. And it can be caused by diet, antibiotics, or infection. Can manifest digestive issues like constipation, bloating, diarrhea, cramping, indigestion, that sort of thing. And it would be bad if you got on the internet, got a blind date, and then she had all that. So that would, you know, could be rough. Just that's a side thought that just came to me.
Well, then they'd have to have a section on there, healthygutdating.com.
Yeah, maybe check that box, because if you can't check that box, then I'm not going to take it.
You know, I had a partner, like I told you, in law enforcement for about a year, and he had, I'm trying to think, it was either Crohn's or irritable, whichever one makes you run to the restroom all the time.
Well, yeah, okay.
Is that both of them?
Both of them.
Okay.
Yeah.
And it was pretty serious. I can remember us getting ready to get in a fight, and he says, we're gonna have to pull back because I've gotta run into this, seven, whatever, and run to the restroom. I'm like, okay, I got 3 guys here, and you're in there ripping your guts out while I'm out here trying to rip their guts out. And but it always had handled. But I used to, and I think that's one of the reasons why I used to get to work with him, because the sheriff at the time was kind of concerned about someone who couldn't handle themselves very well. And they knew, because they had to make allowances for it. He had what they call a profile. I mean, it would kick in about any time, which would be bizarre to me, but because I've never experienced it, so I have sympathy for those folks. But it would kick in at the worst times. Right when we were either in a crowd control or dealing with a unruly person resisting arrest, or like I said, it'd be several people, and he'd have to go, and you're standing there by yourself. And then you just got to take it up a notch at that point.
I'm just saying to you, and I'll probably say to him, we're going to have to figure out, like, how do we use poop as a weapon? Today, I'm just feeling a bit, I don't know what. It's a bit strange today. So,
yeah.
But I'm just saying when it comes about. But neither here nor there. Let's go back to the main cause of dysbiosis: unhealthy diet, medications. And to address it, dietary changes, lifestyle changes and modifications, potential use of prebiotics and probiotic supplementation to your point, and so increased fiber, switching to a plant-based diet, limiting processed foods and sugar, artificial sweeteners. How many times do we say that? But we still continue to see it all the time. Incorporating fermented foods like yogurt can help restore gut health, back to what you said, and stress reduction, getting enough sleep, regular exercise. And all of these things are associated with cigarette smoking too. It's like, why somebody smokes now,
yes,
it's just beyond, it's just,
and we're in Kentucky, so we see it a lot because it's a tobacco state.
Yeah, I mean, us in North Carolina, I think we lead the country.
Absolutely.
I think, so for what that's worth. But the prebiotics are just types of fiber that the gut bacteria uses as fuel, basically a fertilizer for good bacteria. So that's that. And probiotics are just supplements that contain live bacteria, which can help repopulate the gut with beneficial bacteria. And taking a probiotic with at least 5 billion healthy bacteria can help reintroduce good bacteria into your gut. And that's another topic, but fecal transplants are being used for that too. And so and also it should be noted that the cells of the small intestine depend mainly on glutamine for their maintenance and repair. So that's one supplement that can be used to help with leaky gut. Others may include zinc, prebiotics, probiotics, and digestive enzymes. And one of the other causes of problems that you see is non-steroidal anti-inflammatory drugs like aspirin, Advil, Motrin. They have adverse effects on the lining of the gut, and they will eventually allow microbes and partially digested food particles and toxins to enter the bloodstream. So, to try to be off of those drugs is beneficial. And birth control pills and steroids may also create conditions to damage the lining and lead to leaky gut, and chemotherapy and radiation can significantly disrupt the balance of the GI tract. So cancer patients are at an extreme risk for this. And I think when I look at it, I think a lot of times that point is not stressed enough, in the fact that these chemotherapeutic agents and radiation will damage the gut and lead to all these kinds of problems, in addition to the problems they already have. And that's a tough thing. I wanted to go over a few things. I wanted to go over celiac disease because it's an illness caused by an immune reaction to eating gluten. And gluten is just a protein found in foods containing wheat, rye, or barley. And there's also a genetic component to the disease. About 60 to 70% of people who have celiac disease are women.
Yeah, my nephew, my wife and I's nephew on her side, his wife has it, and then they found out they've got like a 6-year-old son, a daughter and son, but his daughter didn't have it, but the son does.
Yeah.
You know, everything, when they come to state, we have to make sure it's gluten free and all that stuff.
Oh yeah,
And they're pretty well versed on it. I mean, it's amazing how young they start learning what to and not to get a hold of.
Yeah, because like, you know, if you eat gluten and you have celiac disease, you're going to trigger a significant immune response to the gluten in the small intestine, and eventually that will damage the intestinal lining, and it may lead to a lot of problems like malabsorption of nutrients being one of them. And you see this with nausea, vomiting, diarrhea, abdominal pain, fatigue, weight loss or anemia, and failure to thrive in children. And a lot of times people don't think of a child, like to your point, you know, getting that, but failure to thrive is a diagnosis.
Yeah.
And then you have to look, is like, why are they failing to thrive? And so I think we're going to be looking at gut health more than ever before in regards to diagnosis. I think that is becoming more and more prevalent in saying, like, you know what, we understand that gut health could be the reason why this child is here. So you see a decreased iron absorption with that too, so you can get iron deficiency anemia. You can get osteoporosis and osteomalacia because you've got malabsorption of calcium and vitamin D. And you may see mouth ulcers, headaches, fatigue, numbness and pain of the extremities and joints, and elevated liver function tests. And it's also associated with skin rash and blisters. And there's no definitive cure for celiac disease, except avoid gluten and try to really watch what you're doing. But one of the reasons I bring this up is because, and I've operated on somebody who had celiac disease, and it got to the point where their disease was so severe, they had a very virulent and advanced small intestine cancer. And you don't see small intestinal cancers very much, and when you do, it's usually like involved with lymphoma, something along those lines. And the problem with small bowel cancers is that they can, they've got plenty of room to grow before symptoms occur. And that's why, and they're very, and for celiac disease, it's a very virulent kind of cancer, and the fact that just means it's very aggressive. And so your chances of survival are lessened when you have a celiac disease associated malignancy. So it's something that I wanted to bring up because I don't think a lot of people, the people that I've talked to that have celiac disease, they weren't aware about that aspect, that, oh, you mean this, what, it's like, is it that serious? Yeah, it's that serious. So anyway, I wanted to bring that up. And then the other thing I wanted to bring up too is this thing about Crohn's disease and ulcerative colitis. And I can't tell you how many times I've operated on both of those. A lot. And they're autoimmune diseases where essentially the body is just attacking itself. The immune system is just attacking itself. And it's Crohn's disease. They differ in location and how the inflammation will affect the digestive tract. Usually, they can be controlled with diet modification and medication. They usually can be controlled to where somebody can at least approach a normal lifestyle. But the complications that are seen with those diseases, they're not small complications. They're big and they're life-threatening a lot of times. But Crohn's disease, this was always like major board questions for us when, in surgery. But Crohn's disease it can skip area. It can go anywhere from like the tongue to the anus, and it can skip areas of small, like you may have something in the esophagus or stomach, and you may have something in the large intestine. So there's skip areas in Crohn's disease. And so the inflammation is usually it affects all the layers of the intestine that I described. That's why I went into detail about the layers of the intestine, because Crohn's disease penetrates all layers. And what does that, well, I'll tell you what it means here in a second, but again, abdominal pain, diarrhea, sometimes bloody, fatigue, weight loss, mouth sores, joint pain, inflammation around the anus in particular. And one of the biggest complications that you see are fistulas. And that goes back to the point, it involves all layers of the bowel. So when it involves all layers of the bowel, that means it can get outside the bowel and attach to other things. Like it, you know, a lot of times it's in the ileum and in the first part of the large intestine called the ascending colon. You see that a lot in people with Crohn's disease, and that's why there's a problem with them having malabsorption, because a lot of times when you have to operate on them, you have to take out a significant portion of the ileum, and that's a problem. And they have a lot of perianal fistulas, excuse me, where there's a connection between the anus and the skin, and you know, you'll just see an abscess, and you have to just lay that tract wide open and let the abscess drain. And so it's a very bad problem. And I did want to relate some of my operative experience with this as well, other than perianal fistulas and abscesses, which is extremely common. But a lot of times we see small bowel obstruction because, again, it affects all layers of the intestine. So it will cause stricturing and narrowing of the gut and lead to a small bowel obstruction, which is life-threatening and probably one of the most painful conditions. Because if you can imagine, you've got this muscular tube, and then like all of a sudden now you kink that tube or you block that, something's got to give. And it's a terrible problem. And the fistulas, you know, the fistulas, they don't care where they, you know, they're going to take the path of least resistance. So I've seen colon fistulas connected to the vagina. Needless to say, we don't have to go into that one. You know what that's going to lead to. But one case in particular was a gentleman who came in, and he said, every time I pee, I experience air coming out of my penis. And so he's just going like, what's going on with that? And I'm like, well, I know what's going on. You've got a fistula between your bowel and your bladder. So you have to go in, operate, remove that section of gut, take the fistula down, and make sure that, you know, just try to put some fat around the bowel and fat around the bladder to keep that from happening again. But it's called pneumaturia. And once somebody tells you that they have that, you don't forget that. You know, if you see that one time, you won't forget it. Because, you know, when people say like, every time I pee, there's air coming out of my penis, that ain't normal. So there you go. And now, as far as ulcerative colitis goes, let's see here. Obviously, ulcerative colitis, it's got the same kind of symptoms that Crohn's disease does, but it's just in the colon. So, you know, again, Crohn's disease is skip areas that can involve the colon, but ulcerative colitis sticks to the colon. Okay. And the problem with, one of the big problems with ulcerative colitis, you know, it doesn't affect all layers of the bowel wall. So in that regards, you don't see the fistula kind of thing is not as common. But where you get in trouble on ulcerative colitis, you can get so much inflammation and stricturing and narrowing, you can get what's called toxic megacolon. And that just means that if you see somebody with that, their abdomen looks like Jiffy popcorn, for people who remember that. It's just this big distended abdomen. Mm-hmm. And when you get an x-ray of their abdomen, it looks like a dirigible in the, you know, on x-ray. It's a massive colon. And I've seen that. Then the reason, and one of the cases that sticks out in my mind is a guy that, and most of these people, by the way, when they're diagnosed, are less than 30. But
you think they'd be older, but
yeah, I mean, you can see it in older people. I mean, I've seen Crohn's disease present as appendicitis, and you know, you take the appendix out, You think like, well, it's just acute appendicitis, but it came back as Crohn's disease. And that was in a 67-year-old man, I remember it specifically. But the toxic megacolon will rupture because when you block the valve and you keep eating and secreting, that's got to go somewhere.
Yeah.
And if it can't pass through into the stool, it's going to eventually going to build up so much pressure, it's just basically going to explode. And I'm going to tell you, when you see that, it's like this overwhelming infection and sepsis, because when you open that person's abdomen, you've got a colon that may be like this wide, and it's got a hole in it, and it's just leak, blood, pus, stool, everywhere. I mean, it's like a blood, pus, stool explosion. And so you have to go in, take out the colon, and usually bring out a colostomy, which may be permanent, may be temporary, depending on the person's disease state. And then you have to wash them out with, just basically.
We're going to have to put a graphic disclaimer on this video.
Yeah, liters and liters of saline just to wash all that out. And then, a lot of times they're septic, because when you have that kind of contamination, it's going to get in your bloodstream. So a lot of times these people are in extremis, if you will. They're in the intensive care unit. They're in septic shock, and they're on all kinds of different medications to keep their blood pressure elevated, to keep them alive. I mean, it is a disaster. And I just bring it up. I don't bring it up to scare people. I just bring it up to say, like, it's a fact. It's a fact, and I think that if people are aware of it, then they will know. The point of it is, I'm saying, if you've got Crohn's disease or you've got ulcerative colitis, the chances are you can live a relatively normal lifestyle because they've made a lot of improvements into care and all that sort of thing. But I want them to know, if they don't take care of themselves, this is what can happen to them.
That's why gut health is so important.
Yeah, and so, and a lot of times people just think like, well, they don't even think of these diseases. They think of them as medical.
Thanks for listening to the Dr. Frank and Steve podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.